Welcome everyone to Sunsetting Mountain States, celebrating the end of an era. Today is April 11th, 2024. We want to just share our funding statement. This program is supported by the Health Resources Service Administration, or HRSA, and you can find more information about this funding at hrsa.gov. This is an overview of our first hour and a half together with some introductions and then some state team updates and sustainability plans. But first, we're going to start off with just a quote here to get us in the moment. Each fresh peak ascended teaches something, and we have learned a lot in this time together as Mountain States. So with that, I'm going to turn this over to our project co-directors, Janet Thomas and Kathy Hassel, and then we'll be hearing from Lorraine Swanson from HRSA. So with that, Janet, do you want to go ahead and speak?
Absolutely. Good afternoon, everybody. As most, I hope, would know by now, I'm Janet Thomas. I am the co-director for MSRGN and a clinical biochemical geneticist at Children's Hospital in Colorado. And welcome to our MSRGN sunsetting event. Unfortunately, it is a little bit bittersweet for most of us on this Zoom call today. We've had a great run, and many years of HRSA funding has allowed us to do many, many great things throughout the region. With the broad goals of increasing genetic awareness and access to genetic services, education to providers and families, and admittedly almost anyone who would care to join us, and building a network of support and like-minded individuals across our states, we all, quote unquote, took the bull by the horns and worked to accomplish these goals. For many of us, it was a labor of love. In my own way, I have been involved with MSRGN for a long time, almost since I began my genetics training. I first recall the corn forms we had to fill out in clinic, documenting number of patients served, who was present, diagnosis, etc. Also, I remember the wonderful meetings up in Steamboat Springs. I was also lucky enough to receive grant funding to help with several newborn screening projects and to establish the Metabolic Consortium. More recently, it has also been my privilege and my pleasure to be part of the management team and work with the wonderful group that has helped steer this region. So as we kick off this meeting, I would first like to extend my own thanks to those individuals involved. First and foremost, of course, a thank you to HRSA for such long-standing funding. Although I know we're all sad to see it end, we have actually been quite privileged to have such long-standing funding. I would also like to say thank you for the excellent management team, including those folks at THI, so Stephanie, Michaela, Katie, Sherry, all who kept us on track both financially and did a great job with our many meetings and events. For Liza Creel for all her outstanding evaluation work, my co-director Kathy, our Fed whisperer and great MC for so many events, and of course to Christy, the creative brains behind so many of our excellent projects, and really the one who really did keep us on track and MSRGN running smoothly. And finally, a huge thank you and a shout out to each and every one of you who have participated in some way with MSRGN, either as a state team member, ambassador, navigator, pop-up instigator or attendee, time for genetics clinic, meetings attendees, etc., etc., etc. The list could go on. We couldn't have done this work without you. So thank you for all your time and energy and participation in all the many projects and events that were held over the years. We wish you all the best in the future. So today, please sit back and enjoy this meeting as an update to the last few projects that we're trying to complete, and also as a trip down memory lane to recall all the great things that have been done in the past. And now I'll turn this over to Kathy. Thank you and welcome.
Thank you so much, Jan. And let me say, all these years you've made me go first. That was just an injustice. Thank you so much for all the great words. And I literally would just love to say ditto and move on with our agenda, but I do have a few other thoughts. So as Jan has nicely outlined, many of us have been at this virtual and literal table for genetics, for the individuals living with conditions and their families. We bring our passion, we bring our individual expertise. You know, I'm an adult hematologist. I take care of adults with sickle cell disease. What do I belong in this region? But I do. And every single one of us, no matter what our role has been, has the passion and the care to make things better for individuals affected by genetics conditions, their family, their support. We all come with that passion. And so let me just say, while this is called the sunsetting, it is not the end. And the first half of our agenda today is not just to celebrate what we have done, but in response to requests from many participants, what are we going to do going forward? How are we going to sustain this work? What's happening across the region so that as you step away today, we hope that you see a way that you can continue the collaboration, the collegiality, really the family of Mountain States genetics, and ways that we can continue to interact, ways that we can reach out and continue to serve the people most in need in this region. And so we hope this is a shift, not an ending, and that you will see the opportunities in the first part of this program today, where we will move forward together, maybe in different groups, maybe in different ways, but we will not let this drop. No one on this webinar is going to let it stop and drop. We will continue. And we will take a little time, as all parties should, to celebrate what we've done before. And we hope you enjoy the concluding part of this program today, where we do celebrate the many years of being together as a family in this region around genetics. And with that, I'd like to turn it over to Lorraine Swanson, our HRSA project officer, to invite her perspective and comments today.
Thank you. And I promise we did not coordinate this, but you will hear many of the same themes. I'm in a writing group and recently heard a quote by Frank Herbert, who is the author of Dune. And he stated, "There is no real ending. It is just the place where you stop the story." This quote really struck me as I have been on this journey with the regional genetics networks over the last 2 years at my time at HRSA. As you will be reminded today, this journey has continued over many decades. There are many places where the story stopped and a new story began, whether that was because of new activities or new focus areas, new staff priorities, or new needs from the field. The impact of the regional genetics networks on genetic awareness and education, connections, and infrastructure building will continue. I really want to thank the amazing staff at the Mountain States Regional Genetics Network who demonstrated incredible innovation and commitment to advance the goals of the Regional Genetics Network. As I stated, I was at HRSA 2 years ago and they welcomed me and taught me so much, always professional. And I was so impressed all the time with the wonderful ideas they had. And I want to thank all of you partners and stakeholders who are here, who supported these outstanding efforts in your region. Although we are stopping the story here, it's not really the end for any of us. We're going to take the lessons learned, relationships built, and wonderful ideas to continue growing the system so that we reach our ultimate goal of assuring all individuals affected by genetics receive the care they deserve. And although HRSA has prioritized some other things and our funding is limited, we really do want to acknowledge all of the work that has been done and all of the incredible advancements that have been made over these decades of work. So I hope you have the time to just be able to celebrate and enjoy and acknowledge all of the great work that has been done, and acknowledge that this is just a place where we're stopping the story. It's not the end. Thank you very much.
Thank you so much, Lorraine. We appreciate you being here today and for your comments, as well as Jan and Kathy's. Next, we're going to go into a time of state team updates, and these will include year 7 projects as well as sustainability plans that the teams might have for going forward. And first up, we are going to start off with Texas, and presenting for Texas will be Deborah Friedenberg. Going to have a on screen timer here just to keep everybody in range for 7 minutes. And so, Deborah, whenever you're ready, go
Okay.
ahead.
Thank you. Chrissy, can you bring up our slide? Okay, thank you. So the Texas team also is very grateful for the years that we've had together and the ability to innovate and to advance genetics within the state of Texas, as well as throughout all of the Mountain States regions. And nationally as well, when we've set up some of the more innovative projects we've had. So starting in year 4, we purchased postcard stamps to mail postcards that were going to be designed later, and those did indeed get designed. We formed a group of a subgroup of the Texas State team for individuals who are interested in exploring the manner in which a genetic diagnosis is delivered to a family. Groups become known as the Hope Group of Families, and this group went on to advocate for a speaker on the topic at the 2021 Genetics Summit. And their work continues with Layla and a few new members from Utah who have joined the conversation. We utilized some Facebook advertising, and we also paid some public health student intern to work on compiling an Excel spreadsheet for addresses of primary care offices in Texas. We're a large state, and there are lots of primary care offices. That was kind of a Herculean task. It doesn't sound quite that bad, but there were over 1,000 public health and primary care that were identified. We developed our state team webpage, and then we also designed a postcard, which hopefully will come up somewhere. Is there another slide? In year 6, we distributed 600 Mountain States Genetics Regional Network logo postcards with the QR code. And the QR code led to the Texas State team page with the tag, "Be the Bridge, help families understand and access genetic services to pediatricians across the state." We included a Facebook campaign to Be the Bridge. And the aim of this was to make primary care providers more aware of genetic services and of the needs of families and of those individuals that may have been impacted by genetics conditions. We also, with the remaining team funds that we had that year, explored attending other state-based conferences that will reach providers with the Be the Bridge message and resources. We did a Time for Genetics. We recruited 3 clinics to the Time for Genetics initiative to educate primary care providers in the state. And then we also had an MOU with 2 interns in 2022, where we paid them to do a prospective for a genetic counseling student and a graphic artist who actually designed the mailers. And as we said, these went out to over 600 addresses for clinics across the state for primary care providers. We also, as in year 7, we also had an exhibit at the Texas Pediatric Society, which is the American Academy of Pediatrics branch that is in Texas. And one of the things that was very appealing to us to exhibit at this is the Texas Pediatric Society has aimed to reach new providers, early stage career, as well as medical students and those who are training. And we thought, what a great way to try and reach the future and early on get folks interested and be aware of our resources for genetics. And we've gotten great feedback on the particular postcards as well. And then what we did was we tried to plan for transitioning. And 2 of our team members, Laudris and Farah, actually reviewed the MSGRN website to see where we could host some of our resources. And Lourdes and Farah identified Navigate Life, which is actually a website designed for families and individuals with disabilities that's hosted by Texas Health and Human Services. And we've had lots of discussions with them about what we think should stay from our website and what will need revision. One of the challenges that we've had is identifying where to put the list of genetics providers for the state, because the two options that we had identified, one was a state list, and we know that that's not really being maintained and is not accurate. And the other was the Professional Organization of the American College of Medical Genetics and Genomics. And we do know that that also needs a bit of updating as well. So we have identified, though, working with Navigate Life, hosting the consumer-facing parts of our website. We've also been in discussions with a large genetics group that's heavily involved in genetics education in our state about hosting our professional parts and for the provider of our website. And I guess we haven't quite nailed that down yet, but hopefully we will be there pretty soon. So we think that our website resources will be hosted on other websites within the state, and some national websites as well. So personally, I too have been involved with MSGRN back in the corn days as well. And I'd like to thank all of the teams and all of the people and all of the families and all of the professionals who have helped make the Texas MSGRN team amazing and have accomplished much. And thank you all for your dedication and for your input. And together, I really do believe we have strengthened the resources for families and professionals for genetics in the state of Texas. So again, my last comment is thank y'all. And I have made it with 20 seconds.
Very good. Thank you so much, Deborah, for your input on Texas's projects and sustainability plans. Thank you very much. Next, we're going to go to Utah, and Marzia Pasquale will be speaking for Utah. I'm going to reset the timer here. That's 7 minutes, and I'll bring up Marzia. I put the information that Janelle had sent to me here first.
Yes, thank you, Christy. And again, I echo everybody who has thanked the whole team and the whole group for these many years. I've been part of Mountain States for over 20 years, so this is going to be a hard day. In our state, we started the distribution of Where is Bear in year 4. And we were fortunate that the Department of Health and its newborn screening laboratory helped distributing the books to the pediatrician together with the newborn screening card. In year 6, we decided to have a more focused distribution, and we targeted 30 pediatrics clinics in rural areas. And each clinic received 20 books in English, 10 books in Spanish, and 30 magnets. And we followed up in year 7. We followed up with this clinic to evaluate whether these books had were indeed effective and helped the parents identify some problems, perhaps developmental delays in their children. So we have, with the funding, we have, I can say hired, we have, there was an intern who has helped collecting this data, and she contacted all the clinics that had received the package with the books. only 20 clinics were able to provide some answer. The other clinics, the people contacted were not aware of this initiative. Probably there was a turnover in the personnel. But the majority of the clinics had distributed all the books, and they really wanted to continue distributing the books. There were 7 clinics that acknowledged having made a referral to genetics as a result of a question raised by parents after reading the book, after playing with the Where is a Bear book, which I think is pretty amazing that as a response. And 15 clinics wanted more information from Mountain States. And these clinics were in 19 different zip codes. Now it's very little to see, but the clinics were in all the areas that are purple. So what we are planning to do now, we are looking at this data a little bit more in detail and expanding even to all the zip codes in Utah, because many more clinics have received the books through the Department of Health. In terms of sustainability, we have had several discussions in our state within our team. And there are several initiatives that everybody felt were very important, especially those that are designed to help patients find the right clinic or even interacting with each other, sharing resources for parents and the professional. So we have several, we have listed several options, but we have an amazing genetic navigator in our group, and she has proposed, we are thinking that we are going to use her resources, her institution is available, and to maintain some of these resources within their website. So actually we have a call as soon as this meeting is over. We have our state team call, and we are trying to decide exactly what we are gonna maintain. And in terms really of sustainability, how do we make sure that these resources are kept up to date? So again, this is the final summary for the state of Utah. Thank you one more time to all of you. And I personally am going to miss the meetings and everybody, but hopefully we can see each other in some other occasion. Thank you.
Thank you so much, Marzia. You have a minute left. Was there anything on these infographics that you wanted to highlight? I think you got them all on the other ones, but I do have them here as well.
Yeah, no, that's again, we have made also the book Where is a Bear is available and can be downloaded also from the website, and that's one of the resources that we are discussing. How can we make this available in the future? But
thank you. And just to mention, this was in collaboration with the CDC's Learn the Signs Act Early was the developer of that book. And so we are thankful to them for their partnership in letting us customize that and letting the Utah team customize that. So thank you so much.
Thank you.
All right, next up we have Montana, and Jacqueline Haven will be presenting for Montana. Jacqueline, are you here? Yep. Great, I'll get your slides up here, or your infographic.
Thanks, Christy. Hi, everyone from Montana. I'm Jacqueline Haven. I've been the state team lead since 2021. I'm relatively new to Mountain States compared to lots of you. I've only been on the team 6 years, but it's been a tremendous 6 years, and like the rest of you, it's just a sad day. Really proud of what we've been able to accomplish as a state team over the past couple of years. To just high level point out, we were able to support Montech with some technology. They have a lending library to utilize for telehealth and telegenetics. We've done a lot of pop-up work. We've specifically targeted the early intervention population and providers, and those were relatively well attended. Let's see, Christy, would you mind going to the next slide?
Yeah, no problem.
Thanks. So we were able to have a presence at the Montana AAP meeting in 2022, and we distributed quite a bit of materials and swag from that. QR codes were utilized, and in fact, we had some leftovers from that meeting, so we've been able to repurpose some of those at subsequent events. Last summer, we hosted a symposium here in Helena called Wide Open Spaces, which was a really terrific experience that brought in both providers and families and lots of different people for a conference. And through some funds, we were able to screen a film called Unseen, which was very well received by the audience. Year 7, we unfortunately had to pivot from our planned event. We had really focused on outreach to the Native American tribal communities, and I think due to a number of factors that just really never came to fruition. So we reallocated our funds, and ultimately what we decided upon was to sponsor 79 gas carts for an upcoming family event here in Helena. It's a resource fair for children and youth with special healthcare needs, and it's being sponsored and organized by the Children's Special Health Services through the Department of Health and Human Services at the state. And so really happy to be able to contribute in a meaningful way to that event and help families from across the state of Montana get to Helena via gas cards. So again, not at all what year 7 outlines there, but still a meaningful project nonetheless. And that event is in a couple of weeks. We're very proud of the fact that Montana has often led the statistics with numbers with regard to the events, the summit recordings, the Mountain States, just general. And so we've been very proud that we have a small population, but that per capita we have done well in the rankings that way. So looking forward, we're still in discussions with our state team as far as what it looks like regrouping going forward. We have a close working relationship already with the Department of Health, and we work closely anyway. We are actually waiting on a determination for another HRSA grant that we submitted together regarding newborn screening and follow-up. And so we're really hopeful that in that formalized way, we can continue to partner, but then more broadly, we're talking about different ways that different stakeholders who are interested can continue to have meaningful conversations and keep this momentum moving forward. So, Christy, I think that's all I have.
Great. Thank you so much, Jacqueline. We appreciate you being here and representing the Montana State team. Thanks again. And next up, we have New Mexico, and presenting for New Mexico is Kirsten Bennett. Kirsten, are you available?
Yes, just let me unmute myself.
Yeah,
here.
no worries. And we can see you. Great.
You can see me.
And I'll get to your first slide up here.
Thank you. Well, good to see all of you in, Zoom land, which has been our sort of way of operating here for the last few years. The thing I wanted to point out that came up at our last team meeting, and for sure the group wanted to share this, is one of the things that the New Mexico team has felt very strongly about is the diverse representation on the New Mexico team. We have in New Mexico a number of tribes and Native American nations that are within our borders, and those groups were well represented, you know, in our group. And I think someone mentioned this earlier in the presentation about some language that kind of came out of those sort of early work, is really this diverse team members with a variety of lived experiences, whether it's medical professional, family members, self-advocates, community service providers, tribal members. And one of the things that I think was a sustainable piece, I'm telling the end at the beginning here, is how we talk about individuals and families who are living with a genetic condition, because language is really important in our community. So that lived experience and how we talk about that is really important. The focus sort of overall for all the years that the New Mexico team has been working has been a focus on underserved communities, with telehealth sort of laid over that. And this has to do with some of the strengths of some of the team members that were early adopters and then early advocates for the genetics program and Mountain States work in New Mexico. As others have said, we've had to kind of change the way we've wanted to do things to accomplish goals that we set for ourselves, and also deal with the pandemic, and also deal with the fact that we have a large land mass with not very many people. So if we look at what's happened happened before the previous last 2 years, we had a partnership with Heroes Path, which is a palliative care program. And our plan there was to actually support some family events where a small number of families would come in and get some resources and also have some respite as the families interacted with each other. And unfortunately, COVID kept us from doing that. However, we were able to take that funding and then provide some backpacks, and I think that's probably on the next page, for these families, medically fragile families. So it's a grab and go. So a lot of times families will find themselves having to go to the hospital or go to an appointment, and these clear backpacks, they can see what's in there and they can grab them and they've got everything that they need. The last 2 years, we've been working on the Ehlers-Danlos syndrome materials. So a year ago, we had an intern who compiled a list of primary care providers, and we mailed out the algorithm in packets. And then the intern that we had working with us this year actually tried to follow up with providers who would receive the information. I think one of the biggest things that came out of that work over the last couple of years is our partnership with UNM, University of New Mexico Genetics Program, in how we have characterized appropriate referrals for individuals who may have EDS. So using that algorithm, having regular conversations with that team allowed us to put together a letter which went out with the packets from the UNM program. And so from a sustainability standpoint, that is continued to be helpful, because that letter and the use of the algorithm is an ongoing conversation that the genetics program is having with providers in New Mexico. So I think that's one thing that we can see is going to continue. The other thing that I think from a sustainability standpoint that's important is New Mexico did receive some HRSA funding, which will go to continue to support Department of Health and CMS, which is our Title V program, the Children's Medical Services. There is that continued partnership for care of individuals who are living with genetic conditions through that partnership with UNM, outreach clinics, as well as ongoing conversations about how to best support that population. The other thing that I think all of us have talked about is what happens to those materials, the EDS materials or any of the materials that were on the Mountain States website. So New Mexico has adopted a platform called Finder. And so if you look it up, it's newmexicofinder.org, and it's actually housed in the Center for Development and Disability, which is part of University of New Mexico, where a lot of families already know to go for resources. So the information network has been helpful over decades for that population. And so this is just a new way of making it easier for families to find information and for providers to find information. So the EDS materials have already been moved over there by the person who's in charge of that. And we're looking at some of the other materials in terms of appropriate for them in that particular platform. I think the other thing I wanted to share were lessons learned. One is, we developed really a strength-based approach to creating some awareness of genetic conditions and individuals with genetics, even if we were not as successful as we wanted to in terms of engaging providers in using the materials. Now, we did have 6 clinics that participated in the Time for Genetics, but I think that awareness is important. The other thing that I think lessons learned is that our primary care provider pool is pretty limited in New Mexico, and I think that was a frustration for the team and the interns that we worked with over the last couple of years is having meaningful contact with providers and making sure that they got the information that we needed. So when I spoke with our intern, she said one thing that might be helpful is in future when working on these kinds of things to have more frequent contact and follow-up after. So that's all I've got for you. It was a pleasure to work with all of you, and I appreciate the team and their willingness to participate over the last few years.
Thank you so much, Kirsten. We really appreciate your leadership and Winton's leadership as co-leads. Thanks for being here today. And we'll go to the next state, which is Wyoming. And presenting for Wyoming is Carly Sewell. Carly, are you with us that you can unmute and
I am.
speak? There we go. All right, I'll get your first slide up here.
Good afternoon, everybody. I'm happy to be here as the Wyoming co-lead to talk to you about the work that we have done in the past with MSRGN. I have been a part of MSRGN for close to 20 years, so this is a sad day. For a little bit of context for those that may be new, Wyoming has no practicing geneticists in the entire state, so we do have to contract out those services. And currently, our contract is with Jan's group at Children's Hospital Colorado. So we coordinate outreach genetic clinics within our state with Colorado as our contractor. So with no in-state genetic providers, we were losing referrals to out-of-state providers in different states, just we believe to lack of knowledge of our program. So to that point, we wanted to get something tangible in the hands of providers around the state to let them know about our clinics. So in year 4, we decided to purchase these DNA squishies that you can see with our contact information. And with them, we mailed informational pamphlets to pediatricians all over the state, just letting them know about our program and how they could send referrals to our program for genetic services. In year 5, we purchased Spanish and English Where is Bear books, and we distributed those to pediatricians, nurse practitioners, and family practice physicians. We also updated our MSRGN website with their help to include the resources such as the Where is Bear books, just in case providers appreciated them and would like to order more. In grant year 6, we compiled a list of school nurses, preschool, and Head Start programs. We sent 276 red flags for genetics and genetic connection pamphlets and packages to all of these school nurses, preschools, and Head Start programs, kind of in an attempt to capture a demographic or referral source that we hadn't previously targeted before. So this leads me to grant year 7. Our genetic navigator, Kayla McWayne, she contacted all of the providers that we had previously sent either the DNA squishies to or the red flags for genetics, actually just focusing on the school nurses to see if they had received the content and if they had found it helpful. So thank you to Kayla for all of the hours and time spent calling and getting in touch with the school nurses and the school officials for that. It's greatly appreciated. In terms of sustainability, we have discussed, I am housed, my position is housed within the Wyoming Department of Health. So we are lucky in that we can pretty seamlessly move over any resources from MSRGN's website to our website for folks that may be searching for something like that in the future. So just so we don't lose any of that content that we've created through MSRGN. And also, thankfully, we have a contract going through our routing process within the Wyoming Department of Health with a statewide nonprofit organization that offers advocacy and support for families of children with special health care needs. And Kayla, our genetic navigator, is a family leader within that organization. So we've written into this contract that she or whomever might be in her position in the future would support genetic navigation by assuring that a family leader with lived expertise is made available to families to assist with identifying resources, support, and service organization. So we hope that contract is through 2025, I believe. And so at least for that time frame, we will have some sort of genetic navigation services in Wyoming. I just want to echo what everyone else before me has said in terms of just very thankful for MSRGN and all of the relationships that I've built in the time that I've been a part of it. So I think that's all I had, Christy.
Thank you so much, Carly. And that's really exciting news about the sustainability of that role. So thanks for the update on that. And thanks for being here today to share about Wyoming. Next up, we have Nevada. And I believe we have Cassius sharing for Nevada today. Cassius, are you here?
Oh, yes, ma'am.
There you are. All right, let me get your first slide up. There you go.
Thank you, Christy. And good morning, everyone. So I have only been with MSRGN for, I want to say, about 2-ish years. I apologize that my co-lead for the state, Vicki Ives, could not be here. She is actually, I believe, currently in Oakland, California for our gigantic event for the year called AmChip. She sends her warm regards. And other than that, we're just happy to be with you and happy to be a part of the overall MSRGN family. So regarding what we've been doing here in Nevada, the Nevada State team has engaged in a multitude of actions in order to help families get the help they need. So for the Year 4 project, the Nevada State team developed and hosted a virtual booth at the Nevada chapter of the American Association of Pediatrics meeting. For the Year 5 project, the Nevada State team purchased 1,000 red flags for genetics handouts so that they could be distributed alongside MSRGN magnets in an effort to provide easy access to genetics information and services through the scanning of a QR code, or also just the URL that's there at the bottom. For the Year 6 project, in addition to facilitating 4 genetic connections workshops across Northern and Southern Nevada, the Nevada State team developed and hosted a Grand Rounds event in an effort to provide high-quality genetics information and resources to families and providers who attended the event, and to better understand the challenges faced by those in needs of special healthcare services. An evaluation was disseminated at the conclusion of the event in order to determine how effective the whole program was for the individuals who decided to participate. And that brings us to this year. So for the Year 7 project, the Nevada State team wanted to follow up with the physicians who were previously involved in the Year 5 project in order to determine the ultimate impact MSRGN had on their medical practice and how they addressed the concerns of their patients regarding genetics-based testing and treatments. The team worked together to draft an evaluation for the physicians, which would encapsulate relevant information from their previous interactions with MSRGN, to include how the information gained from MSRGN's efforts have helped them. The team worked with Dr. O, who also could not be here today, who introduced us to Tiffany, who happened to be an intern of his at UNLV and agreed to disseminate the survey to the physicians and get the response data. Regarding sustainability, so the Nevada Statewide Maternal Child Health Coalition, which here we refer to as the MCH Coalition, works with community partners to advocate for preconception health, developmental screening, breastfeeding, physical activity, and more for mothers and children. The MCH Coalition was approached as a possible long-term partner for the Nevada State team. The MCH Coalition agreed to allow the NV State team members to join the MCH Coalition and to have and they've offered us an opportunity to present our findings and other items relevant to genetics to the group as a standing action item during the meetings moving forward. So what that looks like for us practically, say we did something, we were engaged in an activity and we want to share that with them. We would contact them, like I want to say maybe about a month or so beforehand. They will put us on the agenda, and when the day comes, we'll be allowed to speak to everyone about what we have found out. The NV State team is also considering where the best place to house data and other information on the MSRGN website will be. There exist a multitude of great options, and amongst those options would be to house the materials with the Nevada Center for Excellence in Disabilities out of the University of Nevada, Reno, and the Nevada Division of Public and Behavioral Health website, and that's where I work. Either of which will provide broad access to genetics information and services to Nevadans across the state. So that's pretty much what we've been into. But yeah, just to echo what everyone else said, it's been great being with you all. I really appreciate the work that you've done. You've taught me a whole lot, and I wish you all the best. So I'll return to you your 2-ish minutes, Christy.
Thank you so much, Cassius. We appreciate you being here and filling in for Vicky while she's traveling, but you are an amazing leader yourself of the team. So thank you so much for this overview of Nevada's project and that's really exciting sustainability plans for the future with the MCH Council. Next up, we have Colorado, and presenting for Colorado is Erica. Erica, are you here?
I am here, Christy.
All
Thank
right,
you.
great. Thanks for being here, Erica. I'll put up the first year 4 and year 5 slide here.
So I obviously echo what everybody else has said regarding what Mountain States has provided all of us, both personally and professionally over these years. I got my start as a genetic counseling graduate student attending my first meeting in 2002, where the Mountain States welcomed our student cohort with open arms, which was probably the first time I was ever at a professional meeting and felt included. And that idea and that concept of just always welcoming anybody who's interested in genetics has been just the longstanding strength and history of this network. So just wanted to put my plug in there of how grateful I am for all the aspects of Mountain States for supporting me over the years. So during these last few years with our Colorado State team, we very much took advantage of the wonderful Where is Bear book during our initial year of this funding cycle. And we're able to hire an intern to identify 20 different primary care practices across our state to really hone in on both those that were in a metro region as well as those rurally. And we were able to then send out to those primary care providers Where is Bear books, both in English and Spanish. The following year, continuing with both those primary care providers, but also adding in the community center boards, we then did another mailing with the support of Mountain States for hiring an intern, where we were again able to mail out the red flags for genetics. I still have many of those in my office that I love to bring to different meetings, as it is such a wonderful tool for our families and our primary care providers and those community-centered boards. Additionally, during the last few years, we have been working, and when I say we, Jamie has just been instrumental in getting our Colorado Transition Resources Layers of Life birthday cake, both in a usable form on the internet, as well as ensuring that all the links are up to date. And during the next year, we really focused on getting a rack card distributed to all of our different contacts around the state with a very valuable QR code on the back of it, so that families, while they're in the waiting rooms, or our early intervention providers and our community center boards would be able to distribute this rack card that would be then able to be offered to families. During this last year, we continued our efforts both to distribute this rack card, as well as Jamie was again integral for us for conducting a genetics pop-up that focused on our transition resources. This was held in January, and we had over 100 individuals register, which was an amazing response for folks wanting to learn more about this resource, and again wanting to learn what was offered via Mountain States. Also, during this last year, we again hired our third intern during our project to recontact all of our folks in the community, both those PCPs and those CCBs, to do surveys to evaluate the impact of these Mountain States resources and to ensure that if anything was left on hand, we could get those materials again distributed. In recent months, we have been focusing a lot on that sustainability, primarily with a focus of ensuring that this Colorado Transition Resources stays up to date, as these links often change. And with that, Jamie has again just helped us by transitioning from her role as the state team lead here at Mountain States to a role over at our Colorado Family Voices, where she has recently been hired as a family navigator, which has just been a great link for us in the community now to ensure that these efforts continue. And again, that there's we have a champion in Jamie over there that can help continue to keep Colorado Transition Resources up to date via the Family Voices. Just to impact, just to share of what this resource, when it's been out in the community, I just had another request last week that our local 22Q deletion clinic housed here at Children's Hospital is hosting a day at the zoo in May and has asked for as many RAC cards as they can get so that they can again provide this valuable resource to their families, of which many of them are transitioning right now into the adult community. So with that said, I think that is our updates of these last few years, and I am again grateful for our Colorado team and all their efforts, and just with Maria and Jesus and everybody else that's just come together and always worked on these projects. We always started to recognize ourselves as a small but mighty team within the Mountain States region. So thank you for that. And I too am leaving a little bit of time on the clock.
Thanks so much, Erica. And I wanted to just say that one of the themes I've noticed with the interns that Colorado has hired is they've been either prospective genetic counseling students or genetic counseling students. And so you've truly paid it forward, that welcomeness that you felt, Erica, so many years ago to other students that are entering the field. So thank you for that.
I will share, Christy, that one of our students, Emma, who came as a prospective graduate student and she applied for a grant to do her own genetics pop-up, then became one of our GC students, and again offered to intern for us, has recently, as of Monday, rejoined our campus over at the adult clinic. So as a genetic counselor. So she is somebody, as I'm saying it out loud, that I surely will march over some RAC cards for to provide to her in her new role as the one of the genetic counselors in our adult genetics clinic on campus.
That's exciting. Thanks for that update. Awesome. All right, next up we have Arizona. And I believe Kathy Lewandowski is going to be presenting for Arizona. Kathy, are you here?
I'm here, but I see my camera's not working. I really apologize. Can you hear me okay?
We can hear you okay. And I'll
Yeah,
get up the first slide if you can see it. Are you able to see the screen?
Yeah, I can see the screen. Thank you.
Okay, great.
Okay, so first of all, I just really want to thank MSRGN for all the support and training and education they've provided over the years. I've been working on this since about 2017. And I will say that we've learned a lot. And I've noticed that our team, you know, has changed and become more diverse. And, you know, we had 11 team members, which is really thrilling. We had someone representing genetic counselors, Native American. We had several family members with children with special healthcare needs. We had the program manager for children with special healthcare needs. I had someone representing our early intervention program, and also a representative from our family to family raising special kids. So I felt we had a really diverse group. We also had one person that represented Spanish-speaking families and worked with them. So I was pleased that over time we had all these individuals that really wanted to work on genetics and spread the messages. In year 4, we created that was the start of COVID, and so we created the telegenetics brochure for distribution to families, and we put it in our family to family program and Raising Special Kids and at the Phoenix Children's Hospital. And we were able to print out about 1,100 of those brochures. In year 5, we decided that it was very important that we, because we have a large Spanish population in Arizona, to have it translated and have the telegenetics brochure translated into Spanish. And through the individuals that are on the team at other individuals, we've been able to distribute that to many Spanish-speaking families throughout Arizona. In year 6, we were able to present some of the documents that we had worked on at the Arizona Academy of Pediatrics. They always have a summer program, a summer conference in Sedona. And Fran went and presented the developmental delay algorithm document, and she supplemented that with lab code sheets so that the doctors could, you know, understand how they could go together and make it easier for them. And we printed out about 200 of those red flags for genetics. We love that document, and thank you for developing that one. And then during year 6, we decided we'd break up into 2 teams. And because we couldn't decide on one project, we decided to go with 2 projects, clinical trials and late onset conditions. And we worked on those throughout year 6. And then in year 7, we needed to focus on one because we weren't getting either one finished all the way. So we decided that late onset would be the one we would focus on in year 7. And our intent is we wanted something that would could be a resource for families, but also providers. And we're still working on it. We haven't gotten it to the point of being approved yet by the team, but our intent is to continue working on it. And we're wanting a 1-page flyer, but then a link to go to the resources. And that what we want to do is distribute this to at various conferences. We have a lot of early childhood special education conferences. We have, you know, the Academy of Pediatrics will house some of these documents. But we felt that we could finish this up and then we would begin to distribute it next year at our conferences. As far as sustainability goes, we are fortunate that the Arizona Genetic Alliance will house our documents, and they will live on there. And we will also have Raising Special Kids who will be housing some of our documents also, so that you know, the families there can get to them easily. And I think that some of us want to continue on as far as continuing on to maybe work on the clinical trials document to try to finish that one up too, because that was important to us also. And I just want to thank the MSRGN team. You are wonderful. You've made it really interesting. You kept us on track. But you've given us so many things, so many conferences and pop-ups that just were so informative, and I really appreciate you for all the hard work you guys have done for us. We really appreciate it. Thank you.
Thank you so much, Kathy, for being here and sharing this amazing work that Arizona has done. And just for reference, some folks might not know what the Arizona Genetic Alliance is, since there's another organization called Genetic Alliance nationally. So just as a reminder, that is the organization of genetic counselors in Arizona. Is that correct?
Yes, that is. Thank you.
Yeah, so you can take a look at their website in the future for some of those Mountain States and Arizona specific resources to live on. Thanks for that update, Kathy.
Thank you.
Well, our state teams have gone so super speedily through this that we are ahead of schedule here. So we had a break scheduled till 3:25, but if it's okay with everyone, we'd like to just move that up a little bit and maybe just extend our break time. So taking maybe the next 15 minutes. So we're at the top of the hour now. So at 1/4 past the hour, in whichever time zone you are in, you'll need to disregard what's on the screen because we're a little early, but that will give us back some valuable minutes to have some more time to reminisce and have some historical perspective after break time. So please return at 1/4 past the hour, and everyone go enjoy a bio break and grab a snack and come back for some history, some data, some accomplishments, and some memories. See you in a bit. Thank you for starting the recording. And our next hour, we are going to spend with a little bit of a historical review. We have some cameo appearances here from some folks you might recognize. And we're also going to share some timelines just from the historical perspective of Mountain States. We're also going to celebrate some accomplishments, and we're going to have Liza Creel join us and share some data. And then we also have some final thoughts from our project directors, project co-directors, and we will have some photos and a slideshow here at the end to remember some of our times that we got to spend together, either in person or virtually. So with that, we'll jump into our next hour here. And we're going to start off with just a little bit of history. So I had the distinct pleasure of combing through the history books to put some of these slides together, and it's been a fun journey. Whenever we found out the news that the RGNs would be ending, I wondered to myself, well, when did they begin? And so I was able to find this information that in 1976, a legislative mandate was provided by this very long act. I won't read it to you here, but the Omnibus Genetics Bill of 1976, and it actually authorized a national program for basic and applied research and testing for the diagnosis, control, and treatment of genetic diseases. However, though that was passed in 1976, the funds were not actually appropriated until 1978, and $4 million went to MCH, which is Maternal and Child Health, for genetics. Then support was given to develop and disseminate information to the general public and healthcare providers to improve laboratory capabilities for confirmatory diagnostic services on a state and regional level, and to also assist with the establishment of and coordination of statewide programs. So from there, you've already heard Janet Thomas refer to CORN. CORN was established, and CORN stands for the Council of Regional Networks for Genetic Services. And it was a federally funded project to improve the quantity, quality, and availability of cost-effective genetic services in the United States. This was developed in 1985, and I bring it up here because you will hear this mentioned in some of our cameo appearances. So I didn't want you all to think that we were talking about the corn you eat, but rather than the corn or being the Council of Regional Networks for Genetic Services. This is a timeline that I was able to put together, piecing together information both from those who have come before me and also this source down here from Genetic Alliance publication. But a special thanks goes to Joyce Hooker, Celia Kaye, Lori Dean from the Heartland region, and Cindy Hinton from the CDC for their recollections and assistance on the dates. They might not all be perfect and might still need to have some tweaking, but this is the best I could put together from the information I had. So it's really not here to for you all to read the very fine print, but to be here as a reference. We will have these slides posted on our website so that you can reference it. And just to give you some aspects of where we've come from and where we are going and where we are today. So with that, I would like to share this cameo spotlight from our former project director, Celia Kaye. And this was pre-recorded, and I had the pleasure of recording Celia. And so I'd like to share with you today her remarks.
Well, good morning or afternoon. I'm Celia Kaye. I'm a pediatric geneticist, and I had the honor and privilege of being the program director for TextGene back in the early days of the regional networks, and then for Mountain States Regional Genetics Network and Regional Genetics Collaborative. We've done many names over the years, so it is my pleasure to have this time to talk to you about what I remember and what I loved and what I continue to love about the regional networks. I think you all know that the regional networks were started by HRSA, the Health Resources and Services Administration, which is one of the three big branches of Health and Human Services in our federal government. The other two big branches are the NIH and the CDC. But HRSA is specifically charged with making sure that people have access to medical services in our country, and particularly it's aimed at underserved populations in our country. So back when HRSA decided to start regional networks, which was back in the 1980s, genetics was a puzzle to many, many people, physicians and patients. The human genome was nowhere near being sequenced, and genetic contributions to most common diseases and even to many rare diseases were really not understood. They knew they were there, but we didn't have the genes. We didn't have the technology to try to understand how those contributions really worked. So HRSA decided that because genetic services were becoming important, that they needed to do something to make sure that underserved populations had access. Back then, most genetic disorders were untreatable. There were few laboratory tests. So it was a different time. State newborn screening was present, but just for a very few diseases, and there was very little treatment for most of the diseases that you might have been able to diagnose if screening programs had taken them up. Anyway, the regional networks were supposed to bring geneticists together, state health departments together, and uniquely, the networks were supposed to bring what we called consumers, what we still do, but our patients and their families into the conversation to see how genetics could become part of regular medicine. I first got involved with the regional networks back when I was recruited to Texas with my husband in 1989 to the University of Texas Health Science Center in San Antonio. Again, back then, almost all genetics programs were university programs. They were too expensive. Billing and collecting was primitive, and it wasn't possible to be a private practice geneticist in most settings. So the universities were very involved, and HRSA created the genetics networks then, with TextGene being the only one state network. There were 10 networks altogether. TextGene, we hypothesized, was a single state network because nobody else wanted to work with Texas, and if that was true, that was a mistake. But TextGene had a great time being a single state network and getting the large number of geneticists together within the state to work together. I want to stress that health departments were an important part of the regional networks from the beginning, and newborn screening was brought into the picture, as well as maternal and child health bureaus within states. Now, we were, of course, west of the Mississippi, and genetics programs were few and far between in the 1980s in this part of the country. So there were many states within regional networks that had no genetics providers at all. And it was critical that states work together to fill gaps in other states, to help each other at the state health department level, to help each other with newborn screening technology, and to get consumers who were crossing state lines in order to get genetic services into the mix of actually becoming served. Again, I want to emphasize that families and patients were a critical part of the networks from the beginning. This was a HRSA vision, and we knew if underserved populations were being served because the families were there and they could tell us, and they were in leadership roles where they were heard. To coordinate the networks, HRSA created the Council of Regional Networks, or CORN, C-O-R-N. CORN was a fairly primitive committee at the time, didn't have a lot of power, but it had a lot of really well-motivated people who wanted to see that genetic services got to the people who needed them. It was recognized right away that there was no data repository. We didn't know who was being seen by genetics providers. We didn't know who they were, their demographics. We didn't understand what their diseases were. So CORN tried to make a minimum data repository, and they did come up with a system. But remember, this was the 1980s. Computers, of course, existed, but they were not highly available within the medical setting. There were no electronic medical records. We didn't speak to each other over the internet. We spoke to each other by telephone, by snail mail, and by sending in forms. So because HRSA wanted us to collect data, and we were regional networks who were funded by HRSA, we started to collect data on paper forms. There was minimal funding for this really massive effort, but we filled out forms on every patient. We summarized the forms at the end of the year, and we sent them in to the CORN committee on the minimum data set. As you can understand, data were incomplete. There was no real quality assurance. And Jane Lin Fu, Dr. Jane Lin Fu, who was the genetic services branch at HRSA at the time, chief at HRSA at the time, being a meticulous scientist in her own right and a physician, was very frustrated at the quality of the data that we were able to collect. There was a giant in genetics at the time, George Cunningham, who was chief of the genetic services department in the state of California. George had a lot of money through his state. They had an excellent genetic services program, and he was able to collect data. He became the guru overseeing the quality of the data that were collected through this minimum data set. And Jane, genetic services branch director, looked to George to see if the quality of the data was adequate for the purposes that she had. Back then, we had annual meetings with HRSA, just as have been happening ever since. And Jane would look at George and she would say, "George, do we have data?" And George would shrug and say, "Maybe next year." And the next year would come and Jane would say, "George, do we have data?" And George would shrug and say, "Maybe next year." Finally, one year, Jane looked at George and she said, "George, I'm afraid the emperor has no clothes. George, does the emperor have any clothes?" And George, who was rarely silent, was quiet for a few minutes, and then he shrugged and he said, "No, Jane, the emperor has no clothes." That was actually the end of the minimum data set, and before long, that was the end of the first iteration of the regional networks. But when the regional networks went away that first time, something important was lost for genetics. First of all, the emphasis on sharing resources between states that were close to each other but with inadequate resources was gone. We no longer had regular meetings. Of course, relationships that had been built continued to exist to some extent, but there was no resource to bring state health departments, genetics providers, and families and patients together to talk things over and come up with solutions. So that was a big loss. The whole focus on the consumer was diluted with the loss of the original regional networks. And newborn screening, which had finally found a place within clinical genetics, went back to the states and was no longer fundamentally incorporated into discussions of clinical services. Well, HRSA realized that something major had been lost, and so the regional collaboratives were created, and that was the Mountain States Genetics Regional Collaborative. I was contacted by Michelle Perrier, who was the Genetic Services branch in 2007 and 2008, and I was asked to be the program director for the Mountain States Regional Genetics Collaborative. I lived in Colorado at the time, and I was very glad to bring my second state into the Mountain States. Fascinatingly enough, Texas now was included as one of the Mountain States in the 7 collaboratives that were created. I think the Mountain States were happy to work with Texas, and Texas brought a tremendous amount of knowledge, experience, and fervor into the picture, so that Texas became a really fundamental member, as did all of the states in the Mountain States. I do want to remind you that Texas does have mountains. It really is okay to see Texas as a mountain state. The whole middle of Texas is flat, but the western end has mountains that are over 7,000 feet. So we felt justified in being one of the mountain states. Now, once the collaboratives were formed, and they eventually became the networks again, once the collaboratives were formed, wonderful new things came into being. As you know, methods for newborn screening had exploded, and those methods now could be shared amongst the various states. Again, highly qualified people in state departments helped each other where resources were more limited, where knowledge was not as rich. They talked to each other. They helped each other with methodologies. They solved problems for one another. At that time, a uniform panel for newborn screening was being developed. The networks allowed that uniform panel to become widespread across the United States. The Secretary's Advisory Committee on Heritable Disorders in Newborns and Children, SACADONC, our well-loved committee, began vetting new disorders to be added to the newborn screening panel. That information was widely disseminated. Families within states were able to participate in the process, and new disorders were added. So a lot was done through the regional collaboratives and the regional networks, and they have served a tremendous purpose in making genetics a clinical specialty that actually reaches people, particularly underserved people. For me, I have so many fond memories of TextGene, the collaboratives, and the regional networks. Of course, the close, wonderful working relationship with Texas Health Institute was so meaningful to us. THI made this work for the Mountain States, and we had many long conversations, many struggles over getting the grant just right, and THI was there as a partner throughout the entire time. I think the regional meetings with families were amongst the most meaningful to me in all of this association in TextGene, in the collaboratives, and in the regional networks. We sat down together, we talked, we understood some of the struggles that families were having, and they were able to speak as equals within the planning functions of Mountain States, so that their role was clearly leadership and clearly very important. I especially value the time with tribal representatives, and I can't stress enough how struck I was and continue to be with the beauty of the American Indian culture, with the warmth and commitment of these individuals who worked hard daily to bring services to people who are very much in need. I especially remember a meeting at Diné College, which is a Navajo community college, where we were given the opportunity to meet with tribal leadership, with the IRB, which had banned genetic testing in the Navajo Nation, with families who wanted their children to get genetic services if those services would help their kids. And it was a tremendous opportunity to see how things worked within the tribal community and to appreciate the warmth, the fervor, the compassion, the beauty of the American Indian culture. I also valued those wonderful annual or semi-annual meetings with HRSA, where all of the networks got together. And I want to say something especially thankful to Sylvia Au, who was the Hawaii genetics branch director in the state of Hawaii, who brought us delicious macadamia nuts and other treats from Hawaii every time we had a meeting. So I say goodbye to the regional networks and especially to Mountain States with fondness and with regret. Genetic services are at a different place than they were in the 1980s, obviously. Technology has changed, access has changed, professional and public understanding has changed. People may still not understand exactly what genetic services are, and by people, I mean professionals as well as patients and families. But they do understand that genetics is a part of medicine and that new diagnoses and new cures are coming on a regular basis. And I don't think that the role of the regional networks and the collaboratives can be understated, should not be understated, cannot be overstated in how important that role was in getting the word to the profession and to the public. So I'm grateful to have been part of this. I'm so grateful to Mountain States, the staff, and to THI for all the support I was given and for all the friendship and love that I felt coming from this network and from the families and professionals that are in that network. And I believe that the regional networks have contributed greatly to the growth of clinical genetic services in our country, and I am so glad to have been a part of it. Thank you.
Thank you so much for listening to Celia's remarks. She is an incredible mentor to many of us, and we are so grateful for her time and her comments. We'd like to go on now to share a Cameo spotlight, also pre-recorded, with Joyce Hooker, who retired during this grant cycle that we are currently in and has a long, long history with Mountain States as well, which she will share on this recording. I also just wanted to make a note that some of the things that are referenced in both Celia's and Joyce's Cameo spotlights, we have found some of these old documents and have put them on an archive page that we'll be sharing at the end of this sunsetting event today. So Joyce refers to the genetic drift, and Celia referred to the Navajo listening session at Dene College. So if you're interested in learning more about that or seeing some of those old documents, we have been able to find a couple of those and archive them. So with that, I will go ahead and start Joyce's Cameo here. Joyce, can you tell us what your connection to MSRGN is and share a little bit of history about this connection?
Well, I started with the Mountain States Genetics Regional Services Network, a mouthful, back in 1985 when it first was supported by the federal government as a grant. And we applied in 84 and received funding in 85. And at that time, I was a project coordinator, and we had a project director who was Dr. Bob McCurdy. We only had 2 staff people, and it was I was part-time for a few months, and then we soon realized that in order for this project to really function, it was going to take someone full-time. And so I became a full-time employee of the state of Colorado and the Mountain States Genetics Network.
Thank you, Joyce. And I know you went on to do many more iterations of that grant. So do you want to talk a little bit about that?
Well, the grant was funded for a 3-year period. And beginning later on, they did 5 years for, I think, a couple of times, but mainly it was 3 years. And network evolved over those years quite a bit, from 6 states to 7 states to 8 states. So the needs from 1985 to 2002, when it was funded by the federal government, certainly expanded and changed a great deal.
You adopted Texas and Nevada over time.
Yes, yes.
And we always joke that there are mountains in Texas, because that's always a sticking point, right? People think there are no mountains in Texas, but there are.
That there are in Western Texas, and we have one consumer that brought a book to one of our meetings, a coffee table book on the mountains in Texas, Western Texas. So for real.
For real. Oh, thank you for sharing that history. And you went on to continue in your role with Mountain States all the way through this current grant cycle that we're wrapping up in May. But you were very integral in the state team coordinator role and helping the state teams a lot. Do you want to talk just a little bit about that, since it's applicable to this grant cycle that we're in right now?
Well, the state teams, we needed to make a change and to meet the needs of both of our federal granting office and of the region. And so rather than have committees, which were task force, which we had for many years, we went to state teams to meet the needs of the individual states. And I think the beauty, whether you call them committees or state teams, is that in mountain states, we did a merging of both consumers and providers, so that a state team allowed for that merging to become, I think, even stronger, because consumers are the backbone, the heart of what the Mountain States Regional Network has always been.
Thank you, Joyce. That is something very special about this region, is the merging of all voices, all folks around the table, bringing that together. And I know you lived and breathed that for many years. Just one more question on the history, just while we're on that question. What about, you said about till 2002? What happened after 2002? And maybe bring us up to speed a little bit on what happened then, because I know there was a little bit of a gap.
That's true. In 2002, the federal government, in their wisdom, no sarcasm intended, they said they were no longer going to fund regional networks, that they were going to deal with the states individually. And at that time, our funding ended. I retired from the health department at that time too. But we had set up, as had a couple of the other regions, a 501c3 to accompany the Mountain States Network, and had been putting funding through fundraisers, etc., into that foundation, and that was called the Mountain States Genetics Foundation. The foundation had its own board, and it provided the means, resources, both monetarily and staff-wise, because I then became director of the foundation, and provided a means for the network to continue on a limited basis. We couldn't supply grants like we did, and do some of the activities that we would have loved to have kept going, but we did have committees and we did have an annual meeting, and that helped with the cohesiveness of maintaining the network to last until, for 5 years, I believe it was 07, when the feds realized that trying to manage 50 states and 2 territories was a bit beyond what they could really manage. And they brought back the regional collaboratives. New name.
New name, right? New name, but similar mission, correct, as before?
Exactly. Yeah.
Yeah. All right. And then that brings us up to probably 2007 to 2017, when the name changed again to the Mountain States Regional Genetics Networks, and the mission broadened, right, to all genetic conditions.
Well, exactly. But what I think is interesting, we were truly a network. Networking was what made us, what maintained us, and gave us the availability to be able to function to meet the needs of the region. And I'm not sure networking was really understood by our federal office to the extent that we applied it here in this region. But interestingly, we went from network to collaborative and back from collaborative to network. So I think
full circle.
Full circle. Yes.
Thank you for stressing that, because I think you're right. It's always been about the networking and the network that has existed. So what are some of your memories, fond or funny, of Mountain States in whichever iteration you'd like to talk about it? And I'm sure you have many.
There are, and there are many that I wouldn't dare share. But I think early on, we had some fun with my last name. That came up every now and then in meetings, etc. And one of the times we were getting ready to have the genetic drift, which many will remember, but this is in the past, so it's not still published. But we published this educational newsletter, and we were getting together in Carmel. I was going to go out there and meet with 4 of our board members, our advisory committee, to talk about the development and how we could go about this. And all 4 of them, their name was John. So our little group became known as 4 Johns and a Hooker. And we started the genetic drift, and it was a wonderful publication. I think my fondest memories were of our annual meetings and our committee meetings. We had 8 committees to meet all of the needs of the region, and to stay on ahead of technology and be able to make sure that it was being available and quality assessment was being done here in this region. And but our annual meetings were built around networking. We did hikes, and I remember particularly one hike, and I say hike, not strenuous, a little bit more so than a walk, but we had to be careful because we had our members from Arizona and Texas who had to be aware of our altitude, and we had our annual meetings in the mountains. So we'd be on a hike, and there were at least 3 that I'm aware of grants that were applied for that came out of our members talking while hiking. And that when we first started, excuse me, when we first started, this region had vast geographic areas, few services, and not all states had newborn screening labs. Colorado provided for 4 states. 1 state went out of the region, so that people were isolated. Consumers, providers, they didn't know each other. Providers didn't know who their counterparts were in other states. And so the support system developed very quickly. And where other states had some competition between providers, we didn't. We embraced the fact that we now had a forum where we could meet, we could talk, we could share problems. Trust was a big part of it. And so this region operated somewhat differently. We were more cohesive, lots of camaraderie. I think those items are the things that I just cherish. The friendships that were made, very lasting friendships, and got to know each other's strengths and talents and skills, and how to incorporate those so we could have better service system.
What impact has MSRGN had in the field of genetics?
Massive. You know, you don't know what you have till you don't have it. And sadly, I think that's what the next version of all this will be.
Our last question we'll wrap up with. Any other just thoughts or comments about the Mountain States region, or any of the history, or just thoughts or comments as we wrap up?
Well, I've talked about this consumers and the providers, but I could not leave and not talk about our staff. And you'll hear on TV programs, you know, we're a family and we work together for a number of reasons so well. And from the beginning, for the most part, staff have been such a cohesive, loving, caring group for each other. And as you and I know, you need each other to be able to make it all work and be the best that we can be.
All right, please join me in thanking Joyce for sharing her comments with us. Again, another mentor of mine, and so just so appreciative of all of Joyce's dedication and time and work in this region. Next up, I have a letter from Camille Miller. Camille was not able to record with us, unfortunately, but she did send this letter, and so I'm going to take just a moment to read it to you all here on the screen. Dear Mountain States Regional Genetics Network, I'm honored to share with you today. I was the CEO when Texas Health Institute was originally funded in 2007 to administer the Mountain States Genetics Collaborative Center, or MSRGCC. Following my retirement in 2017, I remained on the THI board and had the pleasure of watching this program grow and flourish. In 2017, the program was rebranded and named the Mountain States Regional Genetics Network, or MSRGN. As we gather here today, I'm filled with mixed emotions. On one hand, I'm filled with a sense of accomplishment for all that we have achieved together throughout the duration of this program. On the other hand, I feel a tinge of sadness as we bid farewell to something that has been a significant part of our lives. Over the past decades, we have worked tirelessly, overcome challenges, celebrated successes, and forged bonds that will last a lifetime. Together, we have created memories that we will cherish forever. The success of this program over the years was due to the dedicated team, just to name a few, of Celia Kaye, Joyce Hooker, Janet Thomas, Kathy Hassel, Liza Creel, Christy Weiss, the THI staff, the HRSA grant officers, Jill Sugar, Sunyan Kim, Lorraine Swanson, and all the many volunteers from the 8 states who were committed to ensure that individuals with heritable disorders and their families have access to quality care and appropriate genetic expertise. I applaud all the dedicated work of the genetic navigators, the genetic ambassadors, the families, the MSRGN management team, and the many volunteers. Without your commitment, none of this would have been possible. It is sad to see this come to an end, but I have confidence that those that have been a part of this program for the past decades will continue to find avenues to keep this important and amazing work going. Congratulations on a job well done. Sincerely, Camille Miller. All right, with that, we're going to go into a time of accomplishments, and I'm going to just revisit our timeline here for a moment, and we're going to zoom in on this circled section here of the timeline, and really our last 7 years together, but focusing on specifically this grant cycle coming to an end, or the last 4 years. So jump on the Mountain States bus with me and just ride along this little road here as we just have an overview of the last 7 years since we've been rebranded, as some of our Cameo speakers have talked about, in 2017 as Mountain States Regional Genetics Network. That first year brought a new website, our first state team meeting in Austin, Texas, and the state teams launching in spring of 2018. The second year of the grant was our first genetic summit in San Antonio, Texas. I see some folks that were at that meeting here on the call. We launched the genetic ambassadors. We had a state team meeting in Austin, Texas. We launched genetic pop-ups in 2019 as well. And in year 3, we had our second genetic summit in Albuquerque, New Mexico. And in January of 14th, 2020, before we knew what COVID-19 meant, we submitted the competitive grant application for the current grant cycle that we are in now. The 4-year grant was awarded in the spring of 2020 in the midst of COVID, and that year 4 grant started June 1st, 2020. As you all know, we had to pivot on lots of things that we had proposed in January, including in-person genetic summits. And so in year 5, we had our first virtual genetic summit called Connect the Dots. We launched the Genetic Navigator program in June of 2021, and we also launched the Time for Genetics cohort number 1 in August of 2021. In year 6, we celebrated the second year of the Genetic Navigators. We had a state team meeting in Denver, and we had the Time for Genetics cohort number 2, as well as our 2022 virtual genetic summit, Momentum in the Mountains. And that brings us to our last year of our grant, which started this past June. And that was our 3rd year of our Genetic Navigator program, our cohort number 3 of our Time for Genetics initiative, our 2023 Genetic Summit with peak performance, and then this event here today, Sunsetting Mountain States. We have in the next month or 2 months, our grant will be ending on May 31st, 2024. With that, I would like to introduce you all to a name that you all know well, Liza Creel, our external evaluator and a former project manager for the Mountain States in the collaborative cycle. And so, Liza, I'd like to turn it over to you to share some of our accomplishments through data.
Awesome. Thanks, Christy, and everybody. I cannot resist the urge to reflect a little bit after the last section. First of all, Joyce never ages, ever. In the many, many years that I have known her, she looks exactly the same, and I hope to only accomplish the same myself. In the moment she was talking, realized how much I have missed her. And a lot of the work we did in the really early years. So, and now I'm tearing up. I was at Texas Health Institute, started that job in 2006, right out of graduate school, had zero idea what I was going to do with my career. And late 2006, early 2007, somewhere in there, I don't know if I volunteered or I was voluntold, but I got to help write that grant for that 2007 award that went to THI. And I mean this sincerely, that getting involved in that work, getting to know Joyce, getting the opportunity to be mentored by someone like Celia and Kathy and Janet changed the trajectory of my career into one focused on research and how we can change systems and change policies to support families. I'm not sure I would be here without getting involved in that work very early on. I worked as a project coordinator on this project for a few years, eventually became project manager, was able to meet Christy, another fortuitous happening in my life, and left THI and Mountain States in around 2013 to get a PhD, because this project in particular made me realize I have some questions I'd like to answer, and I need some training to be able to do that. In 2016, I came back as the external evaluator, and since then, I'm kind of known as the data person, and I don't know if that makes people excited about slides like this or not so excited about slides like this. But there's been lots of evaluation work over the years and across all of those cycles that you saw funded in Christie's timeline. In the more recent years, so specifically kind of the last 7, our evaluation has really broadened, and I would say strengthened empirically. There has been, through HRSA's leadership and the leadership at the National Coordinating Center, a really intentional effort to be systematic in what we are measuring across RGNs. Knowing that each RGN itself is also doing more than just measuring these national metrics. But these national metrics are really valuable in us tracking performance over time, and in us understanding how 7 different regions with 7 different teams, multiple different needs, and many different strategies all lead towards accomplishing the same goals. And so it's been a really exciting time to be part of this work. And it's work I will remain very, very, very proud of for the rest of my career. One major area of focus in Mountain States and in all the regions is education. The educational efforts of MSRGN are extensive. There's the Genetic Summit, there are the pop-ups, there are the events as part of Time for Genetics. That's just to name a few. What you can see on this side is that there has been substantial growth in educational reach, particularly to providers who practice in medically underserved areas. So you heard Celia mention several times that HRSA and these RGN systems really focus on reaching individuals and families who are medically underserved. We've also focused extensively on reaching providers who actually deliver care in those underserved communities. So lots of outreach here to many different types of providers and to individuals and families. These are data from just this last 4-year cycle. You can see that year 7, we only have data on the first 6 months of that year. So that's why you see that kind of caveat in that final bar on each of these bar graphs. Next slide, Christy. So the summit is definitely the largest event that Mountain States hosts. And it has experienced what we can call, with every bit of confidence, exponential growth since 2020, but really since 2018. So just a note here, of course, the summit was in person in 2018 and 2019. So quite a bit smaller because of the travel support that was funded through Mountain States, and has grown a ton, right? Since it went virtual in 2021, we've seen higher and higher registration every year, higher and higher actual live attendance every year as well. So something we in Mountain States are very proud of. The summit drives both live participation and, because most recently the presentations have been virtual, it's produced recorded content for continuing education. And we've seen, as you can see in the purple boxes there, major growth in asynchronous, if you will, participation in summit-related educational activities. So we've had many more continuing education sessions claimed by both live participants, excuse me, and also those accessing that content after the fact through enduring credits. Next slide. Here you see who's participating in the summits. So genetics providers have always been a target group, of course, and the growth in genetics professionals who are participating has been really extensive. That includes physicians, that also includes genetic counselors, nurses who practice in genetics clinics, etc. So that growth over the years has been rather large. That's the peak you see there. It's actually a beautiful mountain view of genetics professionals and the growth over time. But you also see that there's extensive participation by public health practitioners, by individuals and families, and other types of providers and family leaders as well. Another major area of focus that all of the RGNs have been looking at, that was really a priority area of HRSA's, is around the RGNs helping families connect to genetic services. There are 2 programs within the MSRGN that have really targeted these, what we call facilitated connections, both the Genetic Navigator program and the Time for Genetics program. So both of those focus on facilitating connections to genetics care from both within the healthcare system and outside of the healthcare system. Both programs, you'll see Navigator here and then Time for Genetics on the next slide, have had really great success. In the Navigator program, there have been over 250 families receiving 250 facilitated connections for families, and in the Time for Genetics, over 600 facilitated connections through some very committed pediatric primary care partners across the region. I'll note, and what you can see here, the dark is kind of dark green is kind of the total. The middle green is those that families who come from medically underserved areas. So a way to really demonstrate that MSRGN through this work is reaching those we were intending to reach, specifically those families living in medically underserved communities. So to kind of conclude is a slide that's going to be available publicly, so you do not have to squint. But we really just wanted to demonstrate to you all, the partners, the state teams, the project leads, the clinic advocates, the clinicians and community partners, that all of the work that you all did made a difference. And MSRGN in 2020 set forth with 5 program objectives set by HRSA, and by the end of the 3rd year, what we call year 6, all of those program objectives have been met. So a huge accomplishment in our region, something we are really proud of. We love this table to be able to say we did it, and also that we did it early. That work continues. We are still tracking data. We're going to report all the data that we possibly can to show your great work throughout the end of the cycle, and to demonstrate really the value of these collaboratives, networks, regional, whatever names they have had over the years. And it's really wonderful to find data to support all of those sort of beautiful stories that we've heard today, that this work really mattered.
Thank you so much, Liza. And I'll just ask if Stephanie or Katie can maybe put the link for the PDF of the program objectives and program project measures in the chat, in case anybody is interested in digging into these further. Those are listed on our website, and the POs or program objectives are listed here, as Liza said. But that's what we set out with. That was our map, if you will, when we started this grant, of what our expectations were from HRSA to meet. And as Liza said, we celebrated a little early last year when the numbers came in that those were all met. And so all the data that we are still collecting and measuring, and will still be turning in May, will still go to these boxes. And so that work is not done yet. So please hang in there with us till the end on that. Thank you, Liza, for your time on that. And with that, I'm going to turn it over to Kathy and Janet for a couple of closing thoughts while I switch slides here and get the photos and slideshow up and ready. So Kathy and Janet, would you like to come back on and share some closing thoughts?
Well, we'll do this in reverse order so Jan can have the final word. I sit back, I've got my tissues. This is just amazing. And what keeps coming to my head, because it will be short and sweet, because I too am tearing up a bit, Liza, is I'm trying to learn Spanish. Late in my life, I'm serving in Central America at times, and I've learned 2 ways to say goodbye. One is adios, which means goodbye, and the other is hasta luego, which means see you later. We're not done. I loved what Lorraine had to say. This particular chapter, even of the story, is ended, but this has been such a passionate group for decades, serving each other and the people in this community, and it will not end. It will continue. And so I look forward to the days where our paths cross, because they will, because none of us is stepping away. It's just going to look different. And so I would say, hasta luego. See you later.
Thank you, Kathy. I would absolutely agree. Although it feels like there's a lot of things coming to an end, I think we could also look at the opportunities that we might see forward as well. And certainly the camaraderie that Joyce pointed out, and from a provider standpoint, knowing the folks within the region, I love that piece about the region, that I can pick up the phone and call the folks I need to talk to. And we have great interactions between the providers, the families, the public health providers as well. It's just been a great opportunity. And I thank you all for letting us serve in a variety of roles over the years. And I do think, as Celia said, I think genetics is stronger now than it was before the networks and before the collaboratives. And I hope that perhaps over time, HRSA sees that there might be a continued role of a similar network in the future, but we will see, and maybe we'll see some new faces along the lines as well. But it's been wonderful to see everyone on this meeting here. Joyce and Celia's and Camille's words were inspirational still, and so hopefully we can all take something away that maybe puts a little grain to say, boy, I have this great idea, and I know someone in the next state over that I can talk to about this, and facilitate the ongoing work with small little measures along the way. So I agree with Kathy, hasta luego until we meet again. And in the meantime, please enjoy these next few slides and a little trip down memory lane that Christy put together. And she once again did an awesome job to put this meeting together, and certainly these next slides together. So thank you all, and hasta luego.
All right, with that, we will go ahead and play these slide. I'm calling it a photo montage. I am going to put in the chat just one more time what I'm calling the sunsetting library that I put together on the website. We've had quite a few questions in the chat about where the recording will be. So once the recording is processed and up on YouTube, that's where we will house it. So people can go back and listen to it. I know a couple of people had to jump off for clinic or patient calls or family needs. And then also those things like the genetic drift and some of those historical documents are there. Joyce gave a much longer interview. I had to cut it down short to fit this meeting. So if you want to see the long version, that's also posted there. So all of that can be found at the link, as well as this video montage. If you want to watch it again or share it with anybody, that's posted there too. So with that, sit back, enjoy this trip down memory lane. And with that, we will say goodbye and see you later. The mountains are calling and we must go. Thank you all for being here today. We appreciate your time and attention, and we will be wrapping up on May 31st. So we're here if anyone needs anything in the meantime. Bye-bye.
Thank you, Christy. We miss you already.
Hasta luego.